Hi and welcome to part 2 of my ACT feedback presentations. So we've gone from the theoretical development of and creation of ACT to now look at how it might be practically used within clinical practice. As part of that, we're going to look at parts of the Hexaflex, the 6-part model that makes up what ACT is. Today we're going to look at 4 components of ACT, which is acceptance and commitment therapy. The ones we're going to look at are being in the present moment, acceptance, self as context, and diffusion from thought. The reason that I've picked these 4 components to look at together is that they are all what could be considered skills that relate quite closely to mindfulness and your relationship with yourself, with what's going on around you, and also your the meaning you attribute to what's going on around you in relation to yourself. Because as we talked about in the previous presentation, the development of ACT is from relational framework theory. So it looks at how we associate and the meaning we associate with objects and situations. So we'll look at how we might do some of these things, how we might bring it into clinical practice. So, as we can see, that the Hexaflex, the 6-part model, is made up of those 6 components. And as I say, today we're going to be looking at 4 of those. But the key thing to remember is that the ultimate aim of ACT is psychological flexibility. What is the purpose of psychological flexibility? Well, the idea is that we should be aiming to be able to have as many options and choices as how we respond to thoughts or situations as possible. In situations where people are struggling with long-term health issues, mental health or physical health, often people struggle to get out of what would be in some ways considered maladaptive responses to a problem. So somebody with chronic pain staying in all day or avoiding particular movements. What psychological flexibility says is that rather than being constricted to one course of action or avoidance, for instance, that we feel a bit freer to respond more openly and with greater variety, so that we can act more in accordance with our values rather than the pressures placed upon us. So for instance, somebody being faced with returning to work might, instead of only being constricted to one response, which is a raised stress response and avoidance of activity, might be able to look at how they can flexibly achieve what they want to do. So looking at how exercise might be useful, how they can alter what they're doing, and also how they can consider and relate to the particular situation. So being in the present moment fits very, very well with the concept of mindfulness that we have. It's this idea that with a non-judgmental awareness, we can take in what is going on around us, rather than being lost within our thoughts, concerns, worries or feelings, or our interpretations of what is going on around us. It recognises that although our experience of the world is a perception rather than the world as it really is, our interpretation of the information that our senses derive is what I'm getting at, that we can have a perception that is more cluttered, is more based upon concerns or subjective assessments of what is going on, rather than what is objectively, relatively speaking, going on. We have worked, or many people that work through PMS are already aware of mindfulness, and it is present in lots of different forms of healthcare. If you're aware of local IAPT services or other mental health groups, often mindfulness is also present, as in lots of other areas. So being in the present moment, a great way to do this is by using mindfulness exercises. So encouraging somebody to spend time noticing the elements of their breathing, or perhaps what's going on a scene outside, or a soundscape, or even an object. By spending a small amount of time every day, there are some suggestions that we can become more able to tune into the present moment. So this is how I would encourage people to embody the being in the present moment element of ACT. This next element to look at is diffusion of thoughts. And just as the previous element related very closely to mindfulness, I think this one relates very similarly to our understanding of basic CBT models. This is the idea that we do not have to respond to our thoughts as they arise in a reactionary way. But it also needs us to be aware that thoughts that we have an effect on the way that we behave, the way we feel, and also have physiological effects too. Diffusion from thoughts is achieved in a number of ways. It can be done by getting people simply to express their thoughts or concerns, or perhaps in exercises where you get them to consider a situation and to write it out, or even just contemplate it for themselves. By simply being aware of the thoughts as they go through their mind, it allows us to recognize them, how we respond to them. You can then decide, very much in keeping with a CBT model, how you would like to choose to respond to those thoughts once you are more acutely aware of them. And this might mean changing behavior. So perhaps somebody who is very afraid that their disc is going to pop out when they bend forward to pick something from the floor, once aware that that is part of what's going on through their mind in that situation, might decide that actually practicing that activity is going to build their comfort and also their confidence in doing so by disproving this thought. You can also get them to cognitively challenge their thoughts. So if, for instance, they consider themselves to be of low worth and value, you might suggest that they spend time motivationally considering the things that actually they do demonstrate value, and when others do find them important. These might be things you get them to do within the session, but they might also be things you get them to take away and look at on their own. So for an example that's brought up in the happiness trap is by reframing the thought, which is another powerful tool. So it's a way of taking a thought and giving it a different context. So even just by saying, instead of I am a particular thing, as the example on the screen says, I'm incompetent or I'm not good enough, a more honest interpretation is to say that I'm having the thought that I am that thing. So that I am having the thought that I'm incompetent. And this starts to break the power and helps individuals recognize that actually this is what is going on as a thought within their own mind, but it doesn't necessarily mean that it is implicitly true or that they should immediately act upon it. I've heard of other exercises where people sing the thought or assign it a song or a picture to almost kind of make it seem a little bit more ridiculous than otherwise it can sometimes be taken to be. Other examples that are often given within ACT or other related CBT fields are for example, to consider thoughts being clouds within the sky. We cannot control their presence or whether they're dark or light, but that we can alter how we respond to them and that we are separate from them in our response. Another example that's very common within ACT is the use of the bus analogy. So the idea is that the individual is the bus driver on the bus and that the thoughts that they have are the passengers that get on and off. The idea is that you talk the patient through the concept that they are the driver, but in this occasion that the passengers are being rowdy and disruptive, and rather than being happy with the routes that the driver is taking, is shouting orders at the driver, and that the driver has the choice to continue on his route as he is instructed and intends to do. In this case, it's an example of values, or she can choose to deviate from the route following the instructions of the thoughts. The idea is that the analogy works by saying, at the end of the day, you are the person who is driving the bus. You're the person in control of how you respond to your thoughts. And you can choose in what way to respond. It's not easy and it's not pleasant, but you do at least have that choice. Next, we're looking at self as context. There are many theories within psychology, and I do apologize, I'm sure I'm going to butcher many of them, around what the idea of personality and self is. There are some psychologists who attest that it's an entirely artificial creation that is developed by ourselves to give us a concept of who we are, what we do, and how we do it. It's there to allow us to more easily make and quickly make decisions, as in I like pizza, so when I'm choosing what to eat, if pizza is available, it's much easier to go with what I like. But it also helps us relate to other individuals. So there is this idea that it is an entirely artificial thing, and that there is no objective sense of self but what we create. Regardless of the presence or the form of self, very often, as in pain management, we see individuals who are very much stuck or married to their previous sense of self, or at least grieving for that previous sense of self. People talking about that I am hard-working, or I'm a breadwinner, I'm very independent, and often people very frustrated at how things are as they are at present. Going back to being in the present moment, this might make being in the present moment uncomfortable for that individual, and as a result, their self as context might be a significant problem. It may also be a barrier to acceptance of the situation. People might become very frustrated with themselves, and it may altogether be a very difficult situation. By getting people to discuss their current situation and to rationalise the changes that have happened to their life, then you might also get them to work on self as context. Similarly, you could use a values exercise, which we'll cover in the next session. You could get them to look at the things that are important to them and help them try and identify the ways in which they are still living up to those values or working towards them. It might also be a situation where you look at reframing. So getting the individual to look at the elements of self that they feel that they have lost, and to try and see if they can recognise if they're giving an honest appraisal of themselves or not, or if they are being realistic about expectations of an individual in their situation. Similarly, even just by doing the basic thing of making somebody aware of a situation may be useful. And here are some examples of what some of the self that may be held by the people you come in, or indeed yourself who's listening to this presentation. The next and final component that we're going to look at today is around acceptance. I think in my own personal experience of the use of the ACT concept, this is a rather difficult one to work upon, because how can you make somebody go from not accepting a situation to accepting it? And I think in some senses it's all about use of the other components to move towards acceptance of this present situation. So if you can help them reduce their grief around their previous self, if you can help them work at how to be more present in the present moment and to be diffused a bit more from their thoughts, then perhaps they will move towards acceptance. But it is certainly worth recognising that acceptance is an important part of what we're working towards. In fact, you could say it is the single thing that we are working towards in pain management. We cannot get rid of the pain, but we can change an individual's acceptance of their situation and ability to move on with it and to deal with it. You can give examples of how to achieve it. I've come across exercises where you hold something in front of a person's face, not completely obstructing their vision, but certainly making things difficult for them to see, a cup or your hand, and to then instruct them to write a small passage of text on a piece of paper, so like thoughts or values, and to then point out how difficult it is for them to do this if they struggle and try and look round the object that is obstructing their view. Whereas if they try and just focus on the task at hand, the blockage, the problem is still present, but their focus is very much on achieving the thing that they want to and continuing to live their lives. So just to make it a bit more clear that in ACT, acceptance is about not a state or a feeling or it is more around having control by being in the moment and being able to make decisions based upon the situation as it is, not as you'd like it to be or how it has been in the past, and that this can allow us to move forwards onto coping and management. I think it's always rather useful when we're considering these components to go back to the evil twin, or the opposite of psychological flexibility. So in an individual that is struggling, they may have dominance of their previous past and possibly anxiety around a feared future, or catastrophization, as we often talk about. That instead of being in the present moment, they're everywhere else but. They may be attached as part of that to a conceptualized self, and this is how I used to be, as we've talked about, and maybe fused cognitively to their thoughts. And that they may be avoiding the situation as it is. This might be making them not go to places that they enjoy going to, or it might be not engaging with family members or friends in the way that they previously did, because this would require them to accept the situation as it was. And I think sometimes it's easy to see things from the flip side, from the opposite, to then allow us to see how we're probably already trying to help people move towards psychological flexibility. So coming soon, we're going to look at the other two components of values and committed action, which combined give you an idea of how to make a full use of ACT. I haven't included them today because I wanted to keep it relatively concise, but also, as I said at the beginning, these components we've looked at today are much more cognitively based and relate in some ways to our understandings of being in the present moment and use of mindfulness and CBT and skills like this. So thank you very much for your time, and I hope that the remaining podcast is useful for you. Thank you very much, and goodbye.